Hey guys, good afternoon. This is Miss Faribault. Welcome to Structure and Function, 1011. We are going to go through a little lecture notes today. I wanted to hit some high points. You'll notice that you have several reference materials under each chapter, some more than others. Over the course of teaching 1011, there are certain chapters that I've noted a little bit of struggle, and I'm going to try to help y'all out by giving a little extra lecture video. This is kind of part of the original video and lecture guide that goes along with your book. I'm actually lecturing out of Structure and Function of the Body, the 15th edition. Few little housekeeping tools that I always like to mention whenever I start my lecture. For example, we're fixing to do Unit 1, and Unit 1 covers Chapter 1 and 2. You'll have some basics to begin with, and basically Unit 1 and Unit 2 are the fundamentals of this structure and function, and then we'll start getting into the systems. Why do we have to have the fundamentals? Because in order to understand the systems, I need you to understand the foundation. In your book, under each chapter, and again, I highly recommend the book. It's optional, but I recommend it because it has a lot of good hints, a lot of good questions that help you prepare for the exam at the end of the unit, because each unit, our exam comes from this book. So I'm going to go through and just let you know a couple of little highlights. This is my little housekeeping. In the very beginning of the introduction to the body, you're going to have an outline. You'll have some objectives that are necessary to meet in this chapter. Then you will have some language of the science and medicine. Before, just like it says in the hint, before you go into this chapter, you need to familiarize yourself with this vocabulary. There is a lot of vocabulary per chapter because there's a lot of things that we cover. You don't have a lot of vocabulary that you will be tested on as far as like spelling, but it's always good to go through, read it, understand it, get the pronunciation of it, and move from there. At the end of each chapter, you're going to have a very nice outline summary. Each part of the chapters will be outlined to the back. If you will, this outline summary is a really good study guide. You can quiz yourself. You can make some really good notes off of this, and I really encourage you to do that. After your outline summary, you'll have review questions, critical thinking, and a chapter test. Pretty much the chapter test is a self-test. It'll really give you a direction in how you will be tested on your exam. The review questions, basically same thing. It hits you hard to make sure that you understand the material that's in the chapter, and I encourage both of those to be done. On Blackboard, at the end of each chapter, you will have a homework. Your homework is due when your unit test is due to be turned in. If you are online, typically that's on a Sunday, so both of those homeworks are due on Sunday. If you're in class, that is prior to the exam. So let's go ahead and get started. I have shared my slide presentation with you all. I'll try to make this quick and sweet, but I do want to cover some of the real high-level information in this chapter as well. So our first is the introduction to the body. What is anatomy and what is physiology? Two of the main things you need to know about in structure and function. Anatomy, cutting apart. It's when we cut apart the human body to study. If you will, think about an autopsy. They cut apart the body to find out a cause of death. They cut apart the body to look at different organs. If it were, for example, homicide, they may need to cut apart the parts of the body to determine what all organs or tissue was involved. Dissection is the technique used to isolate the parts of the human body. And again, the good example that I can give you is an autopsy. Depending upon what they think the cause of death is, or scientific study. If it is some type of malignancy or some type of disease that's unknown to us, there might be an autopsy done for that. Right now we're in a pandemic, and I'm sure that some of the death rate that we have are receiving autopsies, because that's how our scientists determine more and more information to put forward for more and more useful vaccines, treatment, and hospitalizations, to make those hospitalizations shorter. Physiology is the study of the function of the living organism and their parts. So physiologists use scientific experiments to tease out the activity and how the body works. One example that we've noted is that physiologists have figured out how different types of cells in the pancreas release hormones that control our blood sugar levels. This study is continuing to progress. Now people who are put on insulin over a period of time have the possibility, depending on what degree of diabetes they have, they may could go back to a pill form of medication, or eventually even come off of it, depending on the degree, again, of their disease. So those are just a couple of examples and thoughts on the anatomy and physiology. Our next slide is the scientific method. Scientific method is merely a systematic approach to discovery. A lot of us have heard of hypothesis. In our grade school years, we may have had to come up with a hypothesis, come up with a plan. We had to test it. We had to prove it in class. So there's two groups that are considered when we are testing an experiment, two very important groups. You have a test group and you have a control group. So your test group is the one that's involved with the actual product, the test, the specimen. This group receives items from testing. If it's a medication, they may get the medication or a lotion, or they may receive a food. If it's the control group, then this group receives a substitute, or a placebo, if you will. A lot of times when medications are given out, their side effects are listed within the package insert or within the material that's given to the patient. And if you'll note, the next time that you get a medication and it has a package insert, underneath the side effects, it will give you the results of this medication with, like, nausea. You may have 5% that are in the test group that had nausea, where you may also have 5% that were in the control group that have nausea. So therefore it cancels it out, because your control group's having nausea as well as your test group. So that's kind of an example of that. The results of the experiments are taken into account. You've got to have very accurate measurements, and you've got to have accurate recording. It's necessary whenever anybody is doing any type of experiment. If the results of this experiment is supportive of this hypothesis, it's tentatively accepted as the truth. The hypothesis gains a high level of confidence. It's called a law or a theory. Another good example I can give y'all, and I will talk from experiment watching, and a lot of you have probably seen some of the true shows that have been on TV, but one of the shows did an experiment on ginger and nausea and ginger root. and how ginger actually affected nausea in people. Well, they also had a test group and a control group. They had multiple forms of items that they used in their test group, if you will, because they had food, which they would use with the ginger that was in it, like a ginger snap. They had the pure ginger root. They had medications such as promethazine and Dramamine. That's another anti-nausea medicine. And they tested all of these among several groups of people, and then they had a control group. And their evidence and recordings and measurements was strong enough to indicate that, yes, ginger does have a strong effect on nausea. Hence, your mama will tell you to get you some ginger ale if you're nauseated and drink you some ginger ale. In pregnancy, there are only certain medications that women can take, and now they make a lollipop that has ginger in it that they will tell or instruct the pregnant lady before she gets out of bed to get the lollipop with ginger that will cut down on the morning sickness. So I think that's a pretty good example of how the hypothesis becomes law or theory, because now it has been so confident that ginger decreases the nausea. People have started using it widespread to help prevent nausea. Now we'll go on to our levels of organization. What do we mean by our levels of organization? And simply put, that's how the body's put together. What level from A to Z is our body put together? How does each level affect the next? I have in here that the levels are similar to the structure of a home, meaning it starts with the foundation. If you have a foundation of a home and the foundation is not firm and it's not built well, then chances are that foundation is going to fall, and whatever structure on top of it is going to fall as well. If you have a great foundation and you build onto it, then you will continue to prosper and it will be much better as you grow. So that's what I mean by levels of organization. So the body has different levels. Atoms and molecules, they're considered the chemical level. They depend on proper amounts of chemicals and substances in the cell body. Cells are considered the smallest living structures in the body. Tissue is more complex than cells. They are considered to be organized cells that act together to perform one common action. Organs are larger and they're more complex than tissue, thus they're more involved than tissue. And they're a group that several different kinds of tissue are arranged that allows them to act as a unit, act as a unity, or act as a whole and perform a special function. A good example is your heart and your lungs. You know, if your heart stops, your lungs aren't going to breathe. If you can't breathe, you have two punctured lungs, your heart is not going to get the amount of oxygen that it needs or blood flow, so it's eventually going to stop. Systems are the most complex of all. An organization of varying numbers and kinds of organs all work together to perform that complex function of the body. And then you have the body as a whole, and that's the human organism. All atoms, molecules, cells, tissue, organs in the systems, living, breathing, functioning. So we're going to touch on this a lot deeper whenever we get into chapter 4. That's why I have my little note down there at the bottom. There are 4 types of tissue. There's epithelia, connective, muscular, and nervous tissue. The epithelial tissue, that's the sheets that cover and line the body. It forms a continuous sheet that contains no blood vessels. Connective tissue provides structural and functional support. Most abundant and widely distributed tissue in the body, connective tissue is. More varied forms than any other tissue. And again, we're going to dive a lot deeper into the tissue types. I just want to cover this since this is part of our levels. Muscular tissue, it contracts and can produce movement. It has the ability to shorten and contract rather than any other tissue. An example of that is if someone is sedentary for a long amount of time, let's just say for some reason they had some type of accident and they did not move their arm for a year. Well, those muscles are going to contract and pull to their body without the proper use of them. That's why we do a lot of passive range of motion on patients that have been in accidents, is to keep those muscles and muscle tissue moving and the ability for it to move. And then we have nervous tissue, and that senses and conducts and processes information. Rapid movement, communication that happens between the body structures and functions. On this, an example, when we talk about building from the base up, when we talk about the foundation up, and we're talking about building on the levels of systems, I put this in here so that we could all kind of relate to how it's built. An automobile has to have a starting point for the build. What we see in the showroom is the finished product. It's all shiny, it's beautiful, it's ready to drive. What we don't see is what it takes from behind. And so the levels that it takes for us to build in our body, from the cells to the molecules on up, is similar to that of the automobile. Because without those different, we wouldn't have our whole entire system. So we have the chassis, which several parts make up the chassis. I'm not going to go involved into all of those. And then you have the body, and it takes several parts to make the body of the automobile. And then you have the paint, and we all know that there's not just one layer of paint, there's multiple layers of paint, and then there's gloss that goes on top of it. You have the interior of the car, you have the carpet, the headliner, the seats, and then you have the chassis and body mating. You can't take one chassis that's built for a small compact car and put it on a V8 four-wheel drive truck, because they're not compatible. So the same thing in the structure of the levels of organization is it builds off of each other, and it builds what we need for each person. In Unit 2, and further in here, homeostasis is a state of normalcy. Every individual person has a normalcy, and that's where this comes into play as well. Every car chassis has a body mating. Every person has a homeostasis. And like I said, we'll get into that a little bit more. Here's an actual diagram of the levels of organization that I wanted to put in here for you all, from the atom and the molecule, which are considered the chemical level, to the vessels, which are the organelle level, to the neurons, which is the cellular level, to a whole group of neurons and support cells, which is the tissue level, to like the brain and the liver, kidneys, those are the organs, and then you have the organ system. So organ system levels, your skin is considered the integumentary system. The bones are part of the skeletal system. The heart is considered the cardiovascular system. The lymph nodes and spleen are the lymphatic system. Intestines, pancreas, liver, and gallbladder all belong to the digestive system. The bladder is the urinary system. The brain and spine nerves is considered part of the nervous system, and the lungs are the respiratory system. The female and male sex organs are reproductive system, and then your hormones belong to your endocrine system. At any point in time, if you have any questions as we go through this, please feel free to reach out to me. I didn't cover that in the very beginning, but please feel free to email me to ask me any questions. Again, this is a supplemental audio visual presentation just to help bring you through some of the process of this first opening up chapter. So now we're going to talk about the anatomical position. The body is standing erect posture with the arms at the sides and the palms facing forward, just like you see in this position. This is the correct anatomical position. You don't stand up and put your palms facing the back, the palms face forward. Depending upon what field you're going on into will depend on how much you use this anatomical positioning. There's prone, there's supine. You could even go into a criminal justice field, and if you were to come up and work in the homicide division and you found a patient laying flat on their face, you would know that they were found in the prone position. So there's correct anatomical positions, and this is the point of reference. This position that we have shown here is the correct anatomical position. Palms up, hands down beside, facing forward. Anatomical compass rosette. This is something that you definitely need to know. You need to know this throughout, no matter what field you're going in, but specifically in medicine, nursing, phlebotomy, if you're a paramedic, any type of field, this is a really good rosette to keep in mind. Based on your anatomical position, these are the rosettes that go with it. So anterior, distal, inferior. L is the opposite of M. L is lateral. M is medial. That's more towards the midline. So M, remember, medial is midline, towards the inside. Lateral is towards the outside. Okay? L is the opposite of R, which is also left. R is right. P is the opposite of A. So if you have anterior, which is the front, you have posterior, that is behind you. So posterior is the back side, anterior is the front side. You have proximal, and then you have superior. Okay? Proximal is more towards the body, and distal is more away from. So directional terms are used to describe relative positions of the body. Now, I wanted to give y'all an example as to why we would use these positions based on the rosette. If a patient came in and they had a skin cancer on their arm, and the physician were to remove that skin cancer, typically he would do what is known as a tag. He would want to tag a margin or a piece of that tissue so he would know exactly which end belonged where. Because otherwise, the pathologist is going to get this and he's like, oh, this is a piece of tissue. I have no clue. And if one of those margins where the physician made the excision still involves the cancer, then that surgeon or that physician needs to know, hey, I need to go back and take more of that tissue because I did not have what is considered clear margins. Clear margins means there's enough room there that that cancer did not grow into where the excision was made. So basically, to summarize that, you have a spot the size of a pencil eraser. Your physician goes in and removes it. he's going to want to make sure that he gets about twice the size of that pencil eraser, because if it is a malignancy, he has to make sure that he gets and contains all of that malignancy. At one end or top or bottom, he will put a tag on it, which is typically some suture, and he'll call it the distal or the proximal or the medial, depending on where it's at on the body. And that way, if one of those margins is not clear, he will know what part he needs to go back and re-excise. Okay. So here is a breakdown of the directional terms. Superior. Superior is towards the head. It is above. Inferior is towards the feet. I'm going to go here and show you what I am, let you visualize what I'm talking about. So inferior is at the feet. So think of it being below you. It's at the bottom. So inferior is towards the feet, lower or below. Anterior is the front. Anterior is the front of the body, closer to the front of the body. And then you're going to have posterior, which is the back. Posterior is the back. Medial is towards the midline of the body. So if you draw an imaginary line through this body, medial is going to be right in the middle of this body. Think about the umbilicus being a medial point, the middle point. And if it's closer to the middle point of the body, then it would be considered medial. The opposing of that, if it's out towards the arm, it's going to be lateral. It's going to be away from the body. So lateral will be towards the side or away from the midline. Proximal is going to be towards or nearest the trunk or nearest the point of origin. That is what proximal is going to be. So if you had that spot removed from the right upper thigh, that malignancy we were talking about, and it was the right upper thigh, the surgeon may tag the proximal margin that he knew it was closer towards the midline of the body. Okay? Next is going to be distal, and that's the furthest point away from the trunk, the furthest part of the origin. So it might be on the toe. Okay? Then you're going to have superficial, and superficial is just how it sounds. It's near the top. And then the opposite of superficial is going to be deep. So deep is going to be further into the body. If it's deep, it's further into the body. The next thing that I want to talk about are the body planes. And this is basically how we do draw an imaginary line. And we talk about the planes of the body and how we would cut them up. So if you will look at this diagram again, you need to understand how we cut the body into sections and be able to visualize it being into a flat plate called the plane. So we just got finished talking about the superior, which is towards the head. Posterior is towards the back. Anterior is to the front. We have distal. We have proximal, which is closer to the body. And here's another example. Proximal, closer to the body. Distal is further away. And then inferior is at the feet. Well, if we take and we draw a line straight through the body, this is going to be the lateral towards the outsides, and medial is in the front. Another plane, a sagittal plane drawing straight through, this is mid-sagittal. Straight through. Mid-sagittal is sagittal plane that divides the body into two equal halves. Then you have the frontal, and that's the coronial plane. The coronial plane lengthwise divides the structure into the anterior and posterior portions. So remember that the frontal, think about the front and the back, and that's what divides it into the front and the back. And then transverse. Transverse, you got to think about horizontal, being on the horizon, and it's going to divide the structure into upper and lower parts. Typically, this picture does show two, but typically we have one transverse plane that shows upper and lower. And then you have oblique planes, which are at an angle. Oblique planes are typically referred to in radiology. If a knee would be a good example that you can't see straight through, so they may want it at an oblique angle to look behind the kneecap. That would be where you would utilize and hear the oblique plane. Your next slide is actually the description that I just gave you all of the planes. Now we're going to talk about body cavities. Another important use for these is in medicine, when someone comes in and they're hurting or they have a specific issue in a specific region. So the body cavities are divided up, as you see now. There are ventral body cavities and there are dorsal body cavities. Ventral means front, dorsal means behind, okay? It's not a solid structure. The body is not a solid structure. The body has open spaces or cavities that contains organs. There are the two major that I just talked about. There are the dorsal and there are the ventral. If you'll think, when you think about dorsal, think about a dorsal fin on a fish. That is the back. And on us, the dorsal contains the cranial and the spinal cavity. On the ventral, which is the front, it contains the thoracic, the pleural, the abdominal, and the pelvic cavities. Here you'll see the cranial and the spinal. Again, the cranial and the spinal are what are contained in the dorsal. And then thoracic, pleural, we've got the diaphragm listed here. Abdominal, abdominopelvic, and pelvic cavities are all in the ventral. Back up one slide and it will explain those as well. The next thing is this gives you a full description of what's included in those cavities. The ventral, again, is the thoracic. The mediastinum. The mediastinum includes the trachea, the heart, and the major blood vessels in the chest. The pleural cavity is the lungs. The abdominopelvic cavity and the abdominal cavity is the liver, the gallbladder, the stomach, the spleen, the pancreas, the small intestines, and parts of the large intestines, because the lower sigmoid part of the colon is in the pelvic cavity. And the lower sigmoid is what connects to the anus and the rectum. So therefore that and the urinary bladder and reproductive organs are considered part of the pelvic cavity. Again, the dorsal body cavities are the cranial cavity brain and the spinal cavity, which is the spinal cord. I bring up diaphragm only because on the illustration it showed the diaphragm, and the diaphragm is this muscular sheet that separates the thoracic cavity from the abdominal cavity. Diaphragm is very important. If you don't know what the job it is, it helps us breathe. It is a dome-shaped muscle, and it's one of the most important muscles for breathing. Can you damage the diaphragm? Absolutely. You can have trauma. One of the biggest things in an MVA, which is a car crash, is damage to the diaphragm. The seat belts, the steering wheel can cause a diaphragmatic rupture, and it's quite common and often results in either blunt or penetrating trauma, and it's usually associated with abdominal trauma. It can be an isolation, but typically it's life-threatening. That's why when you are or you see someone that's in an automobile accident, it's not necessarily what you can visualize on the outside, whether they're bleeding or, have external injuries, obvious injuries that you can assess. It may be the inside injuries. That's why we always say, let's go to the hospital and get checked out just to make sure that everything is fine. So we're going to talk about the abdominal quadrants. We're going to break down the quadrants and talk about the different areas on the abdominal quadrants. There are 4 major quadrants. The 4 major quadrants are the right upper, the right lower, the left upper, and the left lower. The biggest thing that I want you to recall is your anatomical position. Why do I say remember and recall the anatomical position? Because typically when you're describing a patient, they're in front of you. They may be lying down, they may be standing up. But the hardest and one of the most difficulties is documentation of, is it their right or their left? Because you're standing in front, and that's one thing that you're always going to have to make sure that you recall, is that they're in front of you, so it's going to be their right and their left, and you'll have to make sure that you transpose that correctly. So there's 4, again, major quadrants. There's the right upper, there's the left upper, there's the right lower, and there's the left lower. The right, we break them down into 9 quadrants, and the reason why I say that is the umbilical area could actually be in this area, but if you had an appendix problem, it could even be considered in the umbilical or the right iliac. The reason why we break these down is because we listen to vowel sounds, and it helps us determine where a more specific location for pain is or a specific injury is. So if a patient were to come in and they were hurting in their right lower quadrant, this is the right lower quadrant, but there's a lot of things in this right lower quadrant. You can see that there's colon, there's small intestines, there's reproductive, and there's also appendix. So they may want to break it down to, hey, they're hurting in their right iliac, which means more around the hip and maybe some of the intestines there. Or if they're hurting in the right lumbar region, that might include a little bit more. So depending upon where the injury, the pain, or the pinpoint is coming from may depend on what is actually going on with the patient. Very important that you know these quadrants. You look at these quadrants and you can match up what specifically would be within these quadrants. What organs could actually be in these quadrants. Alrighty. Now, we have 2 major regions or 2 major portions of the body. We have the axil and the appendicular. If you think about that appendix, the appendix is a little tag that hangs off of the colon, which the colon is the main part of the large bowel. Well, your appendix are actually your upper and lower extremities because they attach to the axil, which is the head, the neck, torso, and trunk. Very good diagram here of the body regions. You can look and tell we have the frontal, the orbital, nasal, zygomatic, which is the upper cheek, buccal, which is going to be the lower cheek, and oral, which is the mouth. That's all in the cephalic or the head, and the cranial, upper skull, and the facial. You have a thoracic, and we're talking about the major vessels in the heart. We're talking about the lungs, everything that's up above, and it can even include your axillary. Then you have your abdominal, you have your pelvic. Everything that is in the trunk region is going to be contained in the thoracic, the abdominal, and the pelvic. That is everything that's in the trunk area. Okay. In your textbook, I always like to make sure that I point out there is a table 1-2, descriptive terms for body regions, and it actually tells you exactly what is the actual descriptive term. So a while ago when we were talking about area or body region, a femoral region, example is a thigh. A gluteal region, example is the buttocks. Plantar region is the sole of the foot. Those are very good vocabulary to follow up on. Next thing we're going to talk about is homeostasis. We hit on it a little bit at the beginning of this, and I actually give you 100% definitive what it is. It is physiologists call it relatively consistency of the internal environment. It's a tendency towards stability among independent elements. It's similar to stasis or standing still. Homeostasis is an organism's process of maintaining a stable internal environment suitable for sustaining life. The word homeostasis is Greek. It means similar. Stasis meaning stable. A few things that people think of when they think of homeostasis are equilibrium, balance, stability. Those are just a few of the things that people come to mind when they think of homeostasis. As I told you earlier, there is a normal and then there's an abnormal, but every single person has their own normal and abnormal. It's still going to be within a certain range, but you might be on the higher side of the normal or the lower side of the normal. When your body gets out of its normal, it's fighting to get back where it needs. So that's where we come into our next discussion, which is going to be the feedback. We have feedback controls, which are negative and positive. Negative and positive feedbacks are influenced by what our normals are. In some of the ways that we can regulate ourselves is back to this loop. A good example, and this is actually in your textbook as well, is when your normal body temperature drops and when you get cold and you start to shiver. Shivering is a way that we can make heat, and it helps us to warm back up. Once our body is back to where it needs to be, we'll stop shivering. Or when we put on clothes or blankets, we stop shivering. So that is a way that we can help self-regulate our body. Negative feedback. We are jumping. Okay, there we go. Negative feedback loops oppose or negate a change in the controlled condition. For example, when it's summertime, it's hot, we're outside, we're working, we begin to perspire. Initially, that perspiration cools us back down. Another example would be we're drinking lots and lots of water, excessive amounts of water. Well, our kidneys excrete that excessive amount of water because that's not what we normally have in our system. We go based off of what we normally have. So if you're putting 2 gallons of water in your body today and you typically only drink 2 quarts, your body is going to excrete and get rid of that excess fluid. Positive feedback loop. A positive feedback loop amplifies the changes that are taking place. A great example is birth. Once a pregnant lady goes into labor, she naturally produces oxytocin. And oxytocin helps the dilatation process when birthing. Once she gets through that birthing process, negative feedback takes back over. Another is a cut or a laceration. We begin to form like blood clots, and that is supposed to, the platelets take over, and it keeps us from bleeding like in the small scrapes and scratches that we get. So here was a good example of the positive feedback. So now I want you all to, because that is the end of this information that I wanted to deliver on chapter 1, but I want you all to reflect back and again look at some of these questions, some of the quick check questions that are listed. What is the anatomical position? That's standing straight out with your palms out in front of you. Why are the anatomical directions listed in pairs? Because one opposes the other. So if you have an anterior, you have a posterior. If you have a distal, you have a proximal. That's why they're listed in pairs. And make sure that you know the rosette, know the different types of cavities. What do we mean when we talk about a section of the body, and what are the two major cavities of the body? That would be dorsal and ventral. What's the difference in the right upper quadrant and the right superior quadrant? Very good question to ask yourself. What's the difference in the axial portion of the body and the appendicular portion? The axial portion, remember, is the trunk, thoracic, pelvic, abdominal, and then the appendicular are the extremities. And then make sure that you follow up on the feedback and the homeostasis. So if you have any questions, make sure that you reach out to me. I'll be glad to help you. Again, this is just an addendum to some of the information that I've already listed under Chapter 1, but please do feel free to reach out to me. Thank you so much.